Every second counts during a heart attack, especially if you're alone. Now I know that may sound frightening, but stay with me, because what we're about to walk through together could literally save your life or the life of someone you love. In the next hour, I'm going to give you 5 medically backed, practical steps you can remember even in a moment of crisis. These aren't complicated, and they're not dramatic. They're simple, calm actions that can make the difference between surviving and not. You see, more than 80% of heart attack deaths happen outside of hospitals. That means we can't rely on just getting lucky. We need a plan, one that you can follow even if you're alone, scared, and in pain. So let's breathe together and get prepared. This is knowledge you'll carry for the rest of your life, and it just might be what keeps you in that life. Let's begin. Let's begin where it matters most. Learning how to recognize the early signs of a heart attack. Because knowing what to look for and trusting your instincts when something feels wrong is often the difference between life and death, especially if you're alone. Now, you might think heart attacks are always loud and dramatic, a crushing pain in the chest, someone grabbing at their heart and falling to the ground. That's what we see in movies, right? But real life isn't always like the movies, especially not for people over 50. In fact, for older adults, heart attacks can be subtle, quiet, sometimes even painless. That's what makes them so dangerous. They sneak up on you, and if you don't know what to watch for, you might wait too long. Let me start with the most common warning signs. These are the ones you hear about the most, and they're common for a reason. They happen often. The number one symptom is pressure or pain in the chest, but it's not always sharp pain. In many cases, it feels more like a heaviness, like someone is sitting on your chest, a tightness, a squeezing sensation. Sometimes it feels like indigestion that won't go away. It might come and go. It might feel like it's radiating out to other parts of your body. And that brings me to the next set of symptoms, pain that spreads. For many people, the discomfort isn't just in the chest. It moves into the arms, especially the left arm, or both. It can spread to the jaw, the neck, the shoulders, even the back. Some people feel it in their upper stomach and mistake it for heartburn or gas. But here's what to pay attention to. If the discomfort is new, persistent, and doesn't improve when you rest, you need to take it seriously. Then there's shortness of breath. And this one is tricky because shortness of breath can happen for a lot of reasons. Maybe you climb stairs too fast. Maybe it's hot out. Maybe you have allergies. But if it comes on suddenly, if it happens when you're not exerting yourself, or if it's combined with any other symptoms we're talking about, don't ignore it. That feeling like you just can't quite get enough air, or like you're working harder than usual to breathe. That could be your heart telling you it's in trouble. Next up, sweating. I'm not talking about a little glow or feeling warm. I'm talking about breaking out in a cold sweat. That clammy, sticky feeling, like your body is reacting to something, but you don't know what. That kind of sudden sweating, especially if you're not moving or it's not hot out, can be a major red flag. Now, let's talk about nausea. That upset stomach feeling, maybe even vomiting, is one of the most overlooked symptoms, especially in women. People think they ate something bad, or they assume it's a stomach bug. But when that nausea comes out of nowhere and is paired with other signs, like chest discomfort or dizziness, it could actually be your heart. And yes, dizziness or lightheadedness is another early warning sign. If you suddenly feel like the room is spinning or like you might pass out, especially if it comes with chest pressure or shortness of breath, that's a sign your blood flow is being affected. Your brain isn't getting enough oxygen, and that's a very real emergency. Now, here's where things get even more serious. There's a type of heart attack known as a silent heart attack, and it's exactly what it sounds like. It happens without the classic symptoms. No dramatic chest pain. No warning that makes you call 911 right away. Instead, it might feel like a bit of fatigue, or mild discomfort in your neck or jaw. Maybe you felt a little off that day and thought you were just tired or stressed, but the heart was struggling the entire time. These silent heart attacks are more common in older adults and especially in women. Why? Because as we age, our nerves don't always communicate the same way. Pain can show up differently. Hormonal changes in women, particularly after menopause, also affect how heart disease presents. Add to that the fact that many people over 50 have other conditions like diabetes, arthritis, or gastrointestinal issues that can mask or mimic heart symptoms. And you got a perfect storm for misdiagnosis or delay. It's heartbreaking to say this, but I've heard too many stories of people who ignored their symptoms for hours or even days, thinking it was something minor. They didn't want to bother anyone. They didn't want to overreact, and they paid the price. That's why I want to encourage you to trust yourself. You know your body. If something doesn't feel right, if it feels unusual, persistent, or concerning, don't brush it off. Don't wait to see if it gets worse. It's always better to be wrong and alive than right and too late. Now, let me take a moment to talk about the differences in how symptoms show up in men versus women. In men, the classic symptoms are more common. Chest pressure, pain in the left arm, sweating, shortness of breath. These are the things most men are taught to watch for. But in women, especially women over 50, symptoms can be more vague. Fatigue, nausea, anxiety, back or jaw pain, trouble sleeping. It's not uncommon for a woman to go to the hospital for something she thinks is indigestion or stress, only to find out she's had a heart attack. This matters because women often delay seeking help. They doubt themselves. They're more likely to take care of everyone else before taking care of their own health. If you're a woman over 50 listening to this, I want to speak to you directly. Your body is not lying to you. If something feels off, take it seriously. You are worth the call. You are worth the ambulance. You are worth the care. Now, let me give you something practical you can do right now. A little tool I call the 60-second self-check. If you start experiencing any of the symptoms I've described, pressure in your chest, shortness of breath, unusual fatigue, pain in your arms, jaw, or back, sudden nausea or dizziness, stop what you're doing. Sit down. Close your eyes. Focus on your body. Ask yourself, is this new? Is this different from what I normally feel? Is it getting worse, not better? Take a deep breath. If the symptoms persist for more than a minute, if they don't go away when you rest, then you act. That's your signal. You don't wait another hour. You don't hope it passes. You call for help, because that's your window. That's your body telling you something isn't right. And it's better to call and not need it than to not call and regret it. I also want you to know that heart attacks don't always hit hard and fast. Some build up over time. You might feel strained for a few hours. You might notice a heaviness that comes and goes. You might think you're just having a bad day. But when in doubt, check it out. There's no shame in calling emergency services and finding out it was indigestion. The only shame would be ignoring the signs and never getting a chance to tell anyone. Let's talk about one more thing, your mindset. Because when symptoms start, panic often follows. And panic clouds judgment. It makes us second-guess ourselves. It tells us to wait, to downplay, to convince ourselves it's not serious, that we're being dramatic. But when it comes to your heart, you cannot afford to hesitate. I want you to picture a voice in your head, a calm, steady voice, maybe even mine, saying, take this seriously. Trust yourself. You know your body. That voice will be your anchor. And the more you practice recognizing symptoms now, the more automatic your response will be when it really counts. You don't need to be afraid. You just need to be aware. You don't need to memorize a textbook. You just need to know your warning lights. And now you do. So let's take another deep breath together. You are learning how to protect yourself. You are doing something powerful. And you are getting ready, not just to survive a heart attack, but to recognize one early, to stay calm, and to take control. That's how you save a life. Yours. If there's one action, one move that could save your life in the midst of a heart attack, especially when you're alone, it is this. Call emergency services immediately, not in 5 minutes, not after you drink water, or sit down to see if it passes. The very moment you suspect something is wrong, you make that call, because every second counts. The faster you get help, the better your chances of surviving. That isn't a guess, it's medical fact. Let me be very clear with you. Calling emergency services is not overreacting. It's not being dramatic. It's not wasting anyone's time. It is a life-saving decision. And the people on the other end of that call, the 911 dispatchers or your local emergency response team, are trained for this. This is what they do. They would rather take 10 calls from people who turn out to be okay than miss one call from someone who waited too long. So please, if that hesitation creeps in, if that voice inside your head says, maybe I should just wait and see, I want you to silence it with action. Pick up the phone and call. Now, let's talk about what actually happens when you make that call, because knowing what to expect takes away a lot of fear. It gives you a sense of control when everything feels uncertain. When you dial 911, or whatever your country's emergency number is, the dispatcher is going to answer with a calm, steady voice. They're trained to stay composed even when you're not, and they'll ask you some key questions. Where are you? What are your symptoms? Are you alone? Are your doors locked? Can you get to the front door? If you can give them the clearest, most direct answers you can manage. Your address first. This is crucial. Even if you can't finish the call, if they know where you are, they can send help. Then tell them you think you're having a heart attack. Use those words. Don't try to downplay it or guess what else it could be. Just say, I think I'm having a heart attack. That phrase activates urgency. It tells them this is time sensitive. They'll immediately dispatch emergency medical services. And here's where preparation helps. When you're in the middle of a health crisis, every small action matters. If you're able to get up safely without worsening your symptoms, unlock your front door. Why? Because paramedics can reach you faster. Precious seconds won't be wasted trying to break in or wait for a neighbor to arrive with a key. If it's nighttime, turn on your porch light or any light near the entrance. Make your home easy to find and easy to enter. Then, if possible, sit near the entrance. I know that might sound small, but again, when seconds matter, positioning matters. Sit upright, close to the door. That way, responders don't have to search your home for you. They walk in and you're right there. It makes everything smoother and faster. Another smart move you can make right now, while you're well and safe, is to create a medical information card. Keep it near your phone or on your refrigerator, where emergency personnel are trained to look. On that card, list your name, age, any medical conditions, allergies, current medications, and emergency contacts. Include your doctor's name and phone number. This saves critical time if you can't speak or are disoriented. Responders will know exactly what they're dealing with, and they can avoid giving you anything you might react to. You can take a step further and write, in case of emergency, please read this card. Tape it to the fridge. Place one next to your bedside table and another near your front door. It may seem like overkill, but it's not. These small preparations are like building a safety net. You hope you'll never need it. But if you do, it's already there. Now, let me address something that a lot of folks over 50 struggle with, especially if you live alone. You might hesitate to call because you don't want to bother anyone. You think, I'll just wait and see if it goes away. You're not trying to be reckless. You're being humble, thoughtful. But in this situation, humility can be deadly. Your life is worth the call. Full stop. I've spoken to people who waited 30 minutes, an hour, longer. They convinced themselves it was just heartburn or stress or fatigue. But heart attacks can escalate fast. Damage to the heart muscle begins within minutes, and the longer it goes untreated, the greater the risk of permanent injury, or worse. And here's something many people don't realize. The vast majority of heart attack deaths happen before the patient even gets to the hospital. That means survival is often determined not by what happens at the hospital, but by what happens in those first 10 to 20 minutes. And the one action that leads to survival, over and over again, is making that call for help. There's also something else to consider. If you try to drive yourself to the hospital, you're taking a big risk. Heart attacks can cause you to lose consciousness suddenly. Your blood pressure can crash. You could pass out behind the wheel and put yourself and others in danger. Paramedics are trained to provide treatment en route. They can give you oxygen, administer medication, monitor your vitals, and alert the hospital that you're coming. You get care faster. You get into the ER faster. You get better outcomes. So please, no matter how close you live to the hospital, do not try to drive yourself during a heart attack. That's not bravery. It's gambling with your life. Let the professionals handle it. Now, I want to talk to those of you who use mobile phones instead of landlines. Make sure your phone is always charged and keep it nearby, not buried in your purse, not left in the other room. Develop the habit of keeping your phone on a table next to your chair or your bed, wherever you spend the most time. And if you have a smartphone, learn how to use an emergency call feature. Most phones today have a way to dial 911 without unlocking the device. That's useful if you become disoriented or lose mobility. Practice it once or twice so that in an emergency, you don't have to think. You just act. And let's not forget about voice assistants like Siri or Google Assistant. If your phone is nearby and voice activated, you can simply say, "Call 911," even if you can't move much. Set this up in advance. Test it. See how your device responds. The goal is to make help as close as your voice. Also, consider this. Some phones and smartwatches now come with fall detection or heart rate alerts. They can detect abnormalities and prompt you to call for help, or even do it automatically if you don't respond. These features are not just for the tech-savvy. They're tools of survival. If you can invest in one, it's worth considering. We'll talk more about this later, but I want you to start thinking now about ways to build technology into your emergency response plan. Let's take a breath here. I know this is a lot to take in, but remember what we're doing. We're not just talking about heart attacks. We're building a strategy. We're creating clarity in a moment that is usually filled with fear and confusion. When something feels wrong in your chest or you suddenly can't breathe, your brain might not function the way it usually does. Panic takes over. Thoughts get foggy. That's why having a plan matters, because the plan is already waiting when your mind isn't. So repeat this phrase to yourself. If I feel the symptoms, I call immediately, not in 10 minutes, not after a nap. Immediately. I want you to say it out loud if you can. Make it a mantra. If I feel the symptoms, I call immediately. And let your loved ones know this too. Your spouse, your children, your friends, tell them. If you ever hear me say I'm having chest pain or I don't feel right, remind me to call 911 or call for me. Sometimes, in our stubbornness, we need a gentle push from someone else. Let the people around you be part of your safety net. You are not being a burden. You are not overreacting. You are choosing life. I've met survivors who say the scariest part wasn't the pain. It was the waiting, the not knowing, the decision about whether to make that call. And almost every single one of them says the same thing. I wish I called sooner. So let's not leave it to chance. Let's not wait until the pain is unbearable. Let's act the moment we suspect something is wrong. That's the power of preparation. That's the gift you give yourself. And that's how you survive. Call immediately. Always. There's something truly powerful about knowing what's going on in your own body and how to respond to it. When you're alone and experiencing the symptoms of a heart attack, calling emergency services comes first. Always. But what comes right after that may surprise you. It's taking aspirin. Yes, a small, common pill you probably have in your home already could be a critical part of surviving a heart attack. But it's not just about taking aspirin. It's about taking it the right way at the right time, and only if it's safe for you to do so. Let me be clear. I'm not here to hand out medical advice without caution. This step, like everything else in your heart emergency plan, depends on prior knowledge of your own health. So, before anything, I encourage you to speak with your doctor. Ask them directly. If I ever have a heart attack, Should I take aspirin? They'll know your health history. They'll tell you if it's safe for you. And once you have that green light, it becomes one of the most important tools in your emergency toolkit. So why aspirin? What makes it so powerful in the face of a heart attack? The answer lies in what a heart attack really is. Most people think of it simply as a problem with the heart itself suddenly failing, but that's only part of the picture. A heart attack often happens because a blood clot forms in a coronary artery, the arteries that supply blood to the heart. When that clot forms, it blocks the flow of oxygen-rich blood to part of your heart muscle. That's what causes the damage. The longer that blockage stays in place, the more damage is done. Aspirin helps because it reduces the blood's ability to clot. It makes your platelets, those tiny blood cells that clump together, less sticky. In simple terms, it slows down or stops the growth of that clot. And sometimes, if taken early enough, it can even begin to break the clot apart slightly, improving blood flow. That's why medical professionals often give aspirin right away when someone shows signs of a heart attack. But here's the key: timing matters. Every minute counts, and the sooner aspirin enters your system, the more effective it is. Now here's the part that many people get wrong: swallowing aspirin whole. That slows down the absorption. In an emergency, speed is everything. You want that aspirin to get into your bloodstream as fast as possible. So what you need to do is chew it. That's right. Chew the aspirin. Don't swallow it. It doesn't taste great, I know. It's chalky, maybe bitter. But it works faster when you chew it because it begins absorbing right through the tissues in your mouth and goes into your bloodstream more quickly. That's exactly what you want in that moment. The standard recommended dose during a suspected heart attack is 325 milligrams. That's usually one full-strength adult aspirin, not the enteric-coated kind, the ones that are designed to dissolve slowly in your stomach. Those are great for daily use under your doctor's orders, but not ideal in an emergency. What you want on hand is uncoated, plain aspirin. Even better, have baby aspirin, 81 milligrams tablets, and take 4 of them chewed. That also adds up to 324 milligrams and is just as effective, often easier to chew. Many people already take baby aspirin daily on their doctor's orders, so it may already be in your medicine cabinet. But let's pause here and talk about the times when you should not take aspirin. This is important. If you have a known allergy to aspirin or NSAIDs like ibuprofen, do not take it. If you have a history of gastrointestinal bleeding, recent surgery, a bleeding disorder like hemophilia, or if your doctor has specifically told you to avoid aspirin, then this is not your go-to step. In those situations, aspirin can do more harm than good. That's why your doctor's guidance ahead of time is essential. There's also another consideration. Sometimes chest pain is not caused by a heart attack. It could be due to an aortic dissection, which is a very rare but serious condition where the inner layer of the aorta tears. In that case, taking aspirin could worsen internal bleeding. However, these situations are rare and difficult to identify without medical tools. That's why the emergency call should always come first. The dispatcher may guide you as to whether to take aspirin based on your symptoms. So again, call first. That's non-negotiable. Then, if your doctor's told you it's safe, chew an aspirin immediately. You can even let the dispatcher know you've taken it. This helps them prepare emergency responders. Now let's think practically. If you're alone in distress and possibly panicked, you don't want to be rummaging through medicine bottles trying to figure out which one is the right aspirin. You don't want to be squinting at labels or wondering where you left it. So prepare now. Today, take a small pill box or Ziploc bag and place a single dose of aspirin in it. Clearly labeled. Keep it in an easy-to-reach spot, next to your bed, near the living room chair where you spend most of your time, even in the kitchen drawer. Make it accessible. Better yet, create a heart emergency kit. We'll talk more about this later. But for now, know that having aspirin ready, labeled, and within reach could make all the difference. You can even write a sticky note on container. Chew if heart attack after calling 911. Let's not forget the power of habit. Once you know aspirin is safe for you, make a point of checking your emergency dose every month. Replace it if it's expired. Keep that routine. It takes seconds and it keeps you ready. Just like checking your smoke alarms or refilling your prescriptions, it becomes part of your wellness routine. Now, if you're someone who struggles with remembering what medications are what, that's okay. Consider writing instructions and keeping them with your aspirin stash. A simple index card that says, in case of heart attack, 1. Call 911. 2. Chew 1 full aspirin or 4 baby aspirins if not allergic. That clarity can help not just you, but anyone who's with you, family, neighbors, caregivers. Let's also address something else that comes up often. What if you're unsure if it's really a heart attack? What if the symptoms are mild? Maybe it's just heartburn, you think. Maybe it's anxiety. Here's the truth. You're better off taking the aspirin and it not being a heart attack than skipping it and being wrong. If your doctor has told you it's safe to take, there is very little downside in an emergency situation. And if it is a heart attack, those early minutes can determine how much of your heart muscle is saved or lost. Aspirin won't fix the problem on its own. It doesn't replace medical treatment. It doesn't dissolve the clot completely, but it buys you time. It slows the damage. And in those early minutes, that might be just enough to make a difference between life and death, between full recovery and long-term complications. I want you to imagine that moment, the tightness in your chest, the shortness of breath, the sweat forming. You make the call. Help is on the way. And you know exactly what to do next. You reach for the aspirin. You chew it slowly. You sit upright. You focus on breathing. You know what's happening. You're not panicked. You're prepared. That mindset, that level of calm action, gives your body the best chance to fight. That's the kind of control we're trying to give you right now. Together, I want you to feel that confidence. Even now as you listen to this, you are not helpless in a heart attack. You are not powerless just because you're alone. You've got a strategy. You've got tools. You've got knowledge. And that puts you ahead of the curve. So talk to your doctor. Ask them directly. Is it safe for me to take aspirin in the event of a heart attack? Don't put off. Don't assume. Get the answer in writing if you need to. Once you have it, put the pieces in place. Keep the aspirin in reach. Write the steps down. Practice it in your mind. Create calm through preparation. Your heart deserves that kind of care. You deserve that kind of peace of mind. You are not waiting for a hero. You're becoming one for yourself. And one tiny pill, taken at the right moment, could be your first act of strength when it matters most. Let's take a deep breath together. In through your nose for 4 seconds, hold it, and slowly out through your mouth for 6. Again, in, hold, and out. You might be wondering why we're starting this way, but let me tell you, if you're ever alone and facing a heart attack, your breath could become one of your most powerful allies. In that moment, staying calm isn't just helpful, it's life-saving. Now I know that sounds like a tall order. You're in pain. Your chest is tight. You feel lightheaded, maybe scared. That's normal. Panic is a natural response to distress. But here's the truth no one tells you often enough. Panic makes everything worse. It sends your heart racing faster, puts more strain on a heart that's already in trouble, and can cloud your judgment when clarity is what you need most. That's why controlling your breathing is one of the most important steps you can take after calling emergency services, and, if appropriate, taking aspirin. It helps calm the nervous system. It tells your brain, we're okay, we're handling this. And in return, your body starts to follow suit. The adrenaline slows down. The heart rate steadies. Your blood pressure stabilizes just enough to buy you more time while help is on the way. Let's break this down in the simplest way. When you're anxious or frightened, your body goes into fight or flight mode. That's your sympathetic nervous system kicking in. It's designed to help you escape danger by speeding up your heart, tensing your muscles, increasing your alertness. That's great if you're running from a bear, but it's not helpful when you're having a heart attack. What you need instead is to activate the opposite system, the parasympathetic nervous system. That's the part of your body that calms everything down. It slows the heart. It helps you breathe easier. It brings clarity back to your mind. And the fastest way to activate that system is through controlled breathing. I want you to remember a simple rhythm. Inhale for 4 seconds. Hold for 4 seconds. Exhale for 6 seconds. It's called a grounding breath. It's designed to slow your heart, relax your body, and give your mind something steady to focus on. It doesn't require anything fancy, just your attention and your breath. This technique isn't just for emergencies either. It's a great daily practice for stress management. But in the moment of a heart attack, it can be a game changer. Let's walk through what this might look like. You've called for help. You've taken your aspirin. Now, instead of pacing, instead of lying down flat, you sit up straight, ideally on a firm chair or even the floor with your back against the wall. You place one hand on your chest and one on your belly. You close your eyes, or if you prefer, fix your gaze on something steady. You take a deep, intentional breath for seconds in. Hold 6 seconds out. You focus only on that. Nothing else. Just the air moving in and out of your body. You don't worry about whether the ambulance is 5 minutes or 10 minutes away. You don't judge yourself for being scared. You just keep breathing, slowly and with purpose. That control over your breath starts to give you back control over your body. Now, let me explain why we recommend sitting upright rather than lying down when you lie flat. Especially if you're already feeling breathless or nauseated, it can increase discomfort. It may also make it harder for your heart to work efficiently. Sitting upright helps keep your airway open, reduces pressure on your lungs, and allows better oxygen exchange. That's why paramedics often transport heart patients in a semi-reclined or upright position. So, if you're alone and feeling heart attack symptoms, choose a safe place to sit, something sturdy, not too soft. Sit up straight, but stay supported. Don't try to move around too much. Don't walk across the house if you can avoid it. Stay where you are once you've secured help. Movement can cause more strain, and what your heart needs now is conservation, not exertion. Now let's talk about tools you can use to help with calming your breath and mind. If you have a smartphone or tablet nearby, breathing or meditation apps can be wonderful resources. Many of them are free. Apps like Calm, Headspace Insight Timer, or even the built-in breathing guides on smartwatches can give you visual or audio prompt to follow. These aren't just for yoga sessions, they're for real emergencies too. If you take a few minutes today to download one and practice with once in a while, you'll be better prepared when you need it most. Don't overlook the power of sound either. A soft voice guiding you through breathing exercises can help anchor your mind. If you live alone, maybe set up a playlist ahead of time, something labeled Emergency Calm with recordings or even your own voice guiding you through those breath cycles. It might sound silly now, but in a moment of distress, it can be deeply comforting. Another powerful tip, visualization. While you breathe, imagine a wave slowly coming in as you inhale, then gently rolling out as you exhale. Or picture a candle. When you breathe in, the flame grows. When you breathe out, it flickers gently but stays steady. These images help quiet the noise in your mind and give your breath a rhythm to follow. And here's a secret not many people know. When you extend your exhale longer than your inhale, it signals your body to relax. It tells your brain that you're not in immediate danger. That's why the 4-4-6 breathing pattern works so well. You're teaching your body to switch out of panic and into preservation. But I know when your chest is tight, when your arms hurt, when your head feels cloudy, it can be hard to even remember a number, let alone a technique. So don't put pressure on yourself to do it perfectly. Just aim to slow down. Even if you're only able to count your breaths, that's a start. Maybe it's just in 1, 2, 3, 4, hold out 1, 2, 3, 4, 5, 6. Over and over. Let the counting be your anchor. The goal isn't to stop the heart attack with your mind. That's not how it works. But what you can do is prevent panic from becoming a second emergency, because anxiety can make your symptoms feel worse. It can cause hyperventilation, dizziness, muscle tension, all things that make it harder for you to think clearly. And during a heart attack, clarity is key. You want to be able to hear the doorbell when help arrives. You want to be able to speak clearly to the paramedics. You want to be present. Now, let's be honest. If you've never practiced any of this, it might not come naturally. That's okay. Just like you wouldn't expect to run a marathon without training, you shouldn't expect to master calming your breath in an emergency without practice. So start today. Practice once a day. Just a minute or two. Breathe in for 4. Hold. Out for 6. Let it become familiar. Let it become part of your routine, like brushing your teeth or checking your mail. The more comfortable you get with it now, the easier it will be to access in a crisis. It becomes muscle memory. And muscle memory, in an emergency, is what keeps you grounded when everything else feels uncertain. Let's also talk briefly about the emotional side of this. Having a heart attack is scary. Even just thinking about it can cause anxiety. That's human, but you don't have to carry fear. You can replace it with readiness. You can replace it with confidence that you know what to do, that you are not powerless. When you sit down and breathe during a crisis, it's not giving up, it's stepping into action. You are actively helping your heart. You're giving your body the best chance to survive. And in doing so, you're telling yourself something important. I can handle this. I prepared. I've trained. I know what to do. There's one more thing I want to say, and I hope it stays with you. Strength isn't always about how loud you can shout or how far you can push. Sometimes strength is quiet. It's the steady breath in the middle of chaos. It's the calm decision to sit down, to breathe, to trust your plan. That kind of strength lives inside you, no matter your age, no matter your medical history. And it's yours to use when you need it most. So keep breathing. Even now, practice, prepare, and know this. You have more control than you think. Your breath is your power. And in the middle of a storm, that calm can be your compass back to safety. Let's talk about the part of surviving a heart attack that doesn't start when your chest tightens, but long before that moment ever arrives. Preparation. I know it might not sound as dramatic as the emergency itself, but in many ways, what you do today, right now, can make all the difference in what happens when the clock is ticking and you're all alone. There are 2 final steps I want to walk you through, and these might be the most empowering yet, because they aren't just about reacting. They're about readiness, about building habits and systems into your life that increase your odds of surviving not just a heart attack, but any sudden health crisis. Let's start with communication. If you live alone, or even if you're just alone during the day while a spouse is at work or out running errands, there's something vital you need to do the moment you suspect a heart attack. Reach out. Let someone know. Even after you called emergency services, there's power in alerting another human being who knows you, who cares about you, and who can help guide support to you faster if needed. That can be a neighbor, a family member, a close friend nearby. Whoever it is, make sure at least one person in your circle knows to expect a call or alert from you in an emergency. Now, of course, during a heart attack, you may not be able to physically make a call or text. That's where technology becomes a lifesaver. Medical alert apps, wearable devices, and smartwatch features are no longer just fancy gadgets. They are tools of survival. If you're wearing a smartwatch that can detect irregular heart rhythms, low oxygen levels, or sudden drops in movement, you have a silent partner that's watching your back 24/7. Devices like Apple Watch, Fitbit, or Samsung smartwatches now offer fall detection, heart rate monitoring, and emergency SOS features. Some even allow you to press and hold a button and automatically contact emergency services and your emergency contacts without saying a word. If you don't own one, think about investing in one. I know cost matters, and it should, but consider what you're really buying. You're not just getting a watch. You're getting peace of mind. You're getting an early warning system on your wrist. And if you're living alone, That can be one of the most valuable investments in your health you ever make. Now, there's another option that's less tech-heavy but equally powerful: a medical alert pendant or bracelet. These have been around for decades, and for good reason. They work. With one button press, you can send out a call to a monitoring center that dispatches help immediately. Many modern systems are GPS-enabled too, which means responders can locate you even if you can't speak. Think of them like a lifeline you wear. It's not about being afraid. It's about being prepared. Some folks resist wearing one because they don't like the look, or they feel like it makes them look old or vulnerable. Let me reframe that for you. That bracelet or necklace doesn't say you're weak. It says you're wise. It says you've taken your health into your own hands, and you're ready for whatever comes. That's strength. Now, let's get into the heart preparation. Something I call the heart emergency kit. Think of it like a first aid kit for your heart. It's simple put together, costs very little, but could literally save your life. Here's what you need to gather. First, aspirin. And not just any aspirin. Plain, chewable, 325 milligrams aspirin. None of the coated or extended release versions. Put a small packet or bottle in a Ziploc bag and label it clearly. You're not going to be rifling through your kitchen drawers or pill containers when you're in pain. It needs to be front and center in your kit, and your kit needs to be in a visible place. Near the front door, in a drawer by your favorite chair, or even inside your refrigerator taped to the door, where paramedics often look first for emergency information. Next, include a written medical ID card. Don't just rely on the digital information in your phone. Paper doesn't need a password. Write your full name, date of birth, blood type if known, allergies, medical conditions, medications you're currently taking, especially blood thinners or anything related to your heart, and your emergency contact numbers. Laminate it or place it in a plastic sleeve. Make it easy to read. Then, add a short note with your healthcare provider's name and phone number. If you have a cardiologist or any specialist you see regularly, include their information. Paramedics and ER doctors often make decisions within seconds based on the information they can get. Make sure what they need is right there, easy to access. Include a small list of recent symptoms or episodes if you've had any, even if you think they were nothing. That nothing could be a crucial clue for doctors. And while you're at it, make a copy of your insurance card and include that too. Add a flashlight or a small clip-on nightlight, if you can, in an emergency, especially if it happens at night. Having light can help responders navigate your home quickly and safely. Even more importantly, take a few minutes to walk through your home and think like a paramedic. Are your house numbers clearly visible from the street? Are your doors easy to unlock quickly? Is there clutter near your front door or staircase that could slow someone down? These might sound like small things, but when every second counts, small things aren't small. Now let's talk power, battery power. That is, your phone is your lifeline, so treat it like one. Get into the habit of charging it regularly. Maybe even keep a portable charger in your emergency kit, already charged and ready to go. And set a weekly reminder to check the battery level. Keep your ringer on if you're alone, even if you don't like hearing it. Silence can be a barrier to help. There's also something else to think about. Who else knows about your emergency plan? Who could step in and help if you're not able to speak? It's worth taking an hour one afternoon to sit down with your spouse, kids, close friends, or neighbors and walk them through your kit. Show them where it is. Let them know what you want them to do. It may feel awkward at first, but that conversation could be one of the most important you ever have. While we're on this, let's talk about routine. Survival is often about systems, habits you build that take over when panic tries to step in. If you wear a smartwatch, make it part of your morning routine to check that it's charged. If you take medications daily, store them near your emergency kit so everything is in one place. Consider putting a simple checklist on the fridge. Phone charged, watch on, kit stocked. These aren't signs of worry. They're signs of wisdom. If you want to go even further, you can set up location sharing with a trusted family member through your smartphone. This doesn't mean they're watching you constantly, but it means that if you press your emergency button or suddenly stop responding, they can find you in an emergency. That clarity can mean getting help to you faster. Another life-saving feature, voice commands. Most modern smartphones and smart home devices can be activated by your voice. Spend a few minutes learning how to say, "Hey Siri, call 911," or "Hey Google, emergency services." In a moment where your hands are weak or you've fallen, your voice might be your only tool. Use it. Let me remind you again, none of this is about living in fear. It's about living with confidence. Knowing you've done the work in advance lets you move through life with a lighter heart. You won't always be able to control when or if a heart attack happens, but you can absolutely control how ready you are for it. That readiness is where your power lies. I want you to visualize it. You're at home, watching TV, reading a book, maybe just resting. Suddenly, you feel that pressure in your chest. It's harder to breathe, but you don't panic. You know what to do. You've already rehearsed it. You call for help. You chew the aspirin you prepared. You sit down in your safe spot. Begin your breathing. Your kit is right where you left it, with everything responders need. Your smartwatch has alerted your daughter. The front door is unlocked, lights are on, and before long, help is walking through your door. That's not just a lucky outcome. That's a plan in motion. That's survival. And finally, let me offer this truth. Preparing for a heart attack doesn't mean you're waiting for one. It means you respect your life enough to protect it. It means you value every moment with your loved ones. It means you want to stay here, living, laughing, growing older with strength and dignity. So let today be the day you stop waiting and start preparing. Get your kit together. Test your devices. Practice your breathing. Walk your house and look through the eyes of someone trying to save you. Make it easy for them. Make it easier for yourself. Your life is worth that. You are worth that. And the actions you take today may one day be the very reason you're still here tomorrow. Let's take a breath together now. We've walked through it all. Every warning sign, every step, every tool, every ounce of preparation you need to give yourself a fighting chance when it matters most. And as we come to the end of this time together, I want you to sit with one simple, powerful truth. You are not helpless. It's easy to feel vulnerable, especially as we age. The body slows down. Little aches become daily companions. And sometimes the world can feel like it's moving a little faster than we'd like. But you know what else age brings? Wisdom, experience, the ability to think ahead and make choices rooted not in fear, but in knowledge. And that's what this has all been about. Giving you the power to choose action over panic, preparation over passivity, and confidence over confusion. Let's go over the 5 life-saving steps again, one by one, so they settle deep into your mind. I want you to remember them not just today, but months from now, maybe years from now, when you or someone you love needs them the most. Step 1, recognize the signs. Know your body. Listen when something doesn't feel right. That tightness in your chest, the shortness of breath, the sweating, the pain that radiates to your arms, back, jaw. That subtle discomfort you might have brushed off 100 times before. Don't wait for the pain to be unbearable. Don't talk yourself out of it. Don't think you're being dramatic. You're being smart. You're being alive to your own well-being. And if it's something, it's something. If it turns out to be nothing, you still did the right thing. Because it's always better to act than to second-guess when it comes to your heart. Step 2, call emergency services immediately. Not in 5 minutes. Not after you lie down. Not after you try to ride it out. Right away. Time is muscle. Every minute without treatment damages a heart. Make that call. Speak clearly. Say your name, your address, and that you believe you're having a heart attack. If you can, unlock your door, turn on a light, and sit near the entrance. Let help find you fast. And don't hang up until they say it's okay. That phone call is your lifeline. It opens a door for everything that comes next. Step 3, take aspirin the right way. If your doctor has told you it's safe, Chew a full dose aspirin as soon as possible. Not swallowed whole, not coated. Chew it. It gets into your system faster, helps thin your blood, and can slow the damage being done. If you can't take aspirin because of allergies, recent bleeding, or medical advice, don't force it. But if you can, and it's part of your plan, it might just buy you precious minutes that could change everything. Step 4. Stay calm and control your breathing. This one's harder than it sounds, I know. But remember, panic is fuel for the fire. It speeds up your heart, raises your blood pressure, and makes everything worse. So focus your mind. Slow your breath. Inhale for 4 seconds. Hold for 4. Exhale for 6. Again and again. You don't have to stop the heart attack. You just need to ride the wave until help arrives. Your breath is your anchor. Let it steady you. Step 5. Prepare in advance and build your emergency toolkit. This is the one you do today. Not in a crisis. Not next week. Today. Set up your heart emergency kit with aspirin, your medical ID, your medication list, your doctor's info and contact numbers. Store it where it can be seen: fridge, hallway, bedside drawer. Invest in a medical alert bracelet or smartwatch if you can. Set up emergency contacts on your phone. Create habits that support quick access to help. Keep your phone charged. Share your plan with someone close. Walk your home and make it responder ready. All these small actions build one big safety net. That's the full picture. And I know it's a lot, but none of it is out of your reach. In fact, most of it can be done in a single afternoon. You don't need to do it all at once, but you do need to start. Maybe you begin with writing down your medical info. Maybe you go buy a small bottle of aspirin and keep on the counter. Maybe you sit with your family tonight and tell them where the kit is. Each step is a brick in a wall of protection you're building for yourself. I want you to take a moment right now, before this video ends, and think about someone you love. Maybe it's your spouse. Maybe it's your son or daughter. Maybe it's your grandchild. Now imagine this: you've taken these steps. You've prepared. And because of that, when the moment came, you were still here, still able to laugh with them, hold them, share stories, show up for birthdays, holidays, ordinary Tuesdays. You stayed because you acted. That's the power you have. So I'm going to ask you for a few small things before we part. First, save this video somewhere you can get to it quickly. Bookmark it. Put it on your desktop. Write the steps down. Second, share it. Send it to someone over 50, your sibling, your neighbor, your friend at church. It might be awkward at first, but you're not just sharing a video. You're offering them a second chance. You might save a life.